Hello, it's Cindy from the Osterville Library. And if you remember back in July, I had a talk with the Fire Chief Winn, and we talked about the curve and the swerve, and that hopefully there wouldn't be a resurgence or a second wave of the coronavirus in the fall. And here we are, it's the fall, and the news is scaring us all the time. So we figured we'd go to the expert, our local expert, and check in and see where things stand now. So welcome back, and thank you for taking the time today to talk with us.
Oh, thank you, Cindy. I appreciate it. It's a great opportunity to speak to the folks who use the Osterville Library. And I know that this message and platform went far beyond just the users of the Osterville Library. So I appreciate the opportunity.
So what can you tell us? I mean, we talked about this in July, and here we are.
We did. Yeah, we talked about this in July. And I go back to the very first planning meeting we had with Cape Cod Hospital in the second week of March, where we were told that we should prepare for a series of slight waves over the summer and then a significant uptick of the coronavirus in the fall. And all of the data that we're seeing now is authenticated that and validated that. And for example, this came off of the Commonwealth of Mass website today about COVID-19. You can definitely see the second wave closer to my hand here, with numbers approaching the same as of May, which was some of our highest numbers. You know, in Massachusetts, well, currently in the United States, there's 11.3 million cases of COVID with almost 250,000 deaths, which the fatality number is actually, I think, exceeding what earlier projections were given by the CDC. The state of Massachusetts is also experiencing, you know, as we know, a significant uptick. We've had 193,000 cases of COVID so far in the Commonwealth, 10,360 deaths. And just today alone, the one-day case addition, if you will, is 2,525 new cases of COVID today in the Commonwealth. And I often get asked, is the uptick of cases because of the accessibility to testing? And the answer is clearly yes. You know, without testing, we're not going to know what our case count is. But without testing, there's no metric for us to know the virus's transmission rate. Here in Barnstable County, we're showing 2,374 COVID cases here in Barnstable with 188 deaths and 69 new cases today here on Cape Cod. So the numbers are staggering. Before we started recording, we talked about the hospitalizations. We're not seeing the same rate of critical patients requiring hospitalization. And I think that has to do, and this is an uneducated guess, but I think that has to do with the age group of folks that are actually becoming sick with the COVID-19. And if you remember, Charlie Baker said 2 weeks ago, Governor Baker said 2 weeks ago that our number one transmission group was basically the 20 to 30-year-old folks, either because of gatherings or colleges or those kind of events. They're not as sick as some of the earlier patients who had the comorbidities. So I think that's why we're seeing a lower number of hospitalizations. I think still statewide in Massachusetts today, we're showing that there's 835 patients in the hospitals across the Commonwealth, and 159 of them are in ICU. So that's still a significant number statewide. And I think we're all aware that they've just reopened the DCU Center in Worcester as a COVID-19 infirmary, if you will, to treat just COVID-19 patients, which to me is another sign everyone's preparing for hopefully not the worst, but it seems that way. So the Commonwealth of Massachusetts has a fantastic data source that they publish weekly. It comes out of the COVID-19 Command Center run by the Department of Public Health. And the metrics and the data that they put out in it is very, very interesting. I share it with our fire department every Friday morning when I receive it, and use it as a reminder for us to wear our PPE and remain vigilant. And it's a new way of doing business for us here. So this report as of the Tuesday, November 17th, is showing 2,263 new cases yesterday. And I know there was 2,525 new cases today. So the numbers are clearly climbing.
And I think, you know, when we talked about like the hospitalizations are not as high as before, and that it's younger people, I think that's why the emphasis is on the holiday season coming up now, because where the 20 to 30-year-olds are maybe going home and seeing older relatives, we could see the repercussions of that 2 weeks down the line with the older relatives taking ill or something like that.
I completely agree. I resoundingly agree. And Thanksgiving is a tremendous holiday in my family, and there's nothing better than a house full of my brothers and their children and my parents. And we've elected as a family this year not to do that out of concern for my parents. They're both in their mid 70s. They're of good health, but the risk of possibly exposing them to COVID-19 is too great of a concern for us as a family. And I think the one thing that people should think about is, and I don't have a good example to show you, but there's been a lot of studies that have come out in the last 2 weeks where the asymptomatic folks with COVID-19 are much higher than what was originally anticipated, meaning folks have no symptoms of having the virus and feel great and go about their daily lives, but at the same time, in a position to transmit it to those that are not protected or wearing masks. So I think that asymptomatic piece is something that we really need to pay attention to.
Yeah, and I think it's important now too, where there finally seems now to be a light at the end of the tunnel with, 2 vaccines showing great promise that hopefully
Mhm.
will start to be distributed. And, maybe by early spring, the general population will start to get them, and then we can hopefully start moving that maybe, putting off those big gatherings this time of year, knowing that the end is in sight. We
Yeah,
have a better understanding of the end now than we did when we were talking in July. I didn't think in July we'd even be talking about not being able to be together Thanksgiving or Christmas. So,
I think there's great hope in those 2 vaccines. The studies I've been reading are showing 90% effective. I think it's a series of 2 shots, and both of the vaccines that are being touted on the media. I think I saw last night or the night prior, there's going to be a hierarchy for how folks are going to receive the vaccine because of the limited amount of doses that are available. I think until such time as there can be mass vaccination, we've got to stick to the guidance of the CDC and Dr. Fauci there, with the face coverings, mouth and nose, and then vigorous hand washing, social distancing. And think about inside gatherings now in Massachusetts are 10 or less. It's hard to think of a Thanksgiving or a Christmas with 10 or less people at your home, but that's really what we have to be doing to protect ourselves. And especially like my parents, protect our folks who are in the upper age brackets and potentially have one of the comorbidities that could influence us. So
well, that's good. So let's just check in with all you guys. Is everybody and your team and all that still doing well? And
we are, our folks are extremely professional and dedicated. They really, really care about the citizens in our villages and in providing the highest quality care that we can. We reinforce to them daily the need to wear the proper PPE when we go on calls. We've changed many of the things we do, including having just one of our responders come into someone's home and make an assessment of what's going on there before we commit the entire crew. So that's new to us. That's something very, very different. When someone's in need, usually the whole crew would enter the house and everybody's carrying a piece of equipment. And because of COVID, we've had to reevaluate that. In some cases, we're actually asking patients to walk outside if they're able to, so we can get them onto the cot and then get them into the ambulance, into the hospital. And it's changed a lot for us as a fire department. There's really limited abilities for us to train now together as a department. So we're doing a lot of things like this, Zoom type meetings, a Zoom roll call every day. A lot of our training is on an online or virtual platform, so we're not crammed into one room with one another. But the firefighters and paramedics here at COMM Fire are the best of the best, and they really take their role seriously, and they're all scared. I mean, nervous, I guess would be the better word. Everybody's nervous about picking up COVID and then bringing it home to their families. And it does scare us. It's a scary thing to think about. So we're very vigilant.
Yeah, you guys are amazing. And as I always say, we're so fortunate to have you here. Is there
Thanks.
anything else you'd like to share with the people, have them know before we wrap up?
I would like to let folks know that we have reopened in a new COVID mode for business. When COVID first hit, we shut down our buildings to the public. That still is in place. We have limited access for the public to come into our buildings. We will come outside and help anybody that requires assistance. But I'm proud to say that we've been able to safely restart our Senior Safe program, where when invited, we enter into the homes of the seniors of our community and we conduct a safety assessment to make sure that their wiring is good. There's no frayed cords, there's no trip hazards, there's no unsafe conditions. And we had over 100 requests for Senior Safe inspections in the queue. and we've been getting to them in big bunches, and which is really, really important for some of our seniors. It's the first time they've had some interaction with people, and it's been very, very beneficial. So if there's seniors out there who'd like to participate in the Senior Safe program, it's a fantastic program. It costs you nothing. And some of our trained people would come into your home and conduct an inspection of your home just to make sure that you are living in the safest possible environment as a senior. So you can contact our fire prevention office, the main number, if that's something of interest to seniors in the community. Our fire prevention inspectors have since probably the middle of the summer begun redoing their fire prevention activities. So Mike Martin, and we have a new addition to fire prevention, Patrick, they're out there conducting inspections, wearing full PPE to protect themselves as they go into properties and businesses. So we're trying to be as accommodating as we can to the community. And as always, if you're sick, call us. It's what we're here for. Don't hesitate if you're sick. We will come and help, and we'll all be safe.
Great. I appreciate it so much. And thank you so much for your time today and the expertise and what you do for us in the community. We truly appreciate it. So thank you.
Yeah, thank you. And I wish everyone a healthy and safe Thanksgiving.
Yes, thanks.
Yeah.